Okay, back by popular demand, this is the white blood cell count portion of a complete blood count. Hi, I'm Dr. Joyce Knief. I look at labs really closely so I can get the most out of the labs that my patients already have done. So at the very top, you have the white blood cell count, the WBC. If it's high, usually that means you have an infection of some sort. Your immune system is really mobilized. This is your total count of white blood cells. So like infection is very common to have this elevated. You can also be under stress or pain because when your body is interpreting threat to itself, it's going to send out those white blood cells. So stress or pain, especially if when you are having the blood draw, you're really like freaked out about something, this can elevate the white blood cells a little bit. And on one hand, you can have blood cancers that increase your white blood cell count, but that's like, you know, kind of rare and you want to look at the other breakdowns of the white blood cell stuff. But on the other hand here, things like smoking or higher inflammation states can also just increase your white blood cell activity in general. And on the other hand, if you have low white blood cell activity, this is really common in autoimmune disease or in what we call like viral suppression. And that warrants a little bit of a closer look at whether or not there is any autoimmunity going on and whether or not there's any like smoldering viral infections that are happening. I think it's also worth noting here that if you have a chronically low white blood cell count, you may want to look into what's going on with your bone marrow, just like look into it a little bit more, especially if you're not on any sort of immune suppressive drugs and you don't have autoimmune stuff going on and you don't have like another viral thing that's been going on. Forgot to mention corticosteroids. So if you've been on like a round of steroids and suddenly your white blood cell count is through the roof, that can also cause that. So I would retest after a little while just to see if that white blood cell count just comes back down after that round of steroids. Now let's break down the types of white blood cells that you have. I have a list over here so I don't miss any of them, but you have the neutrophils, the lymphocytes, the monocytes, the eosinophils, and the basophils. The neutrophils are the basic foot soldiers of your immune system. So whenever you have a bacterial infection, it's going to be the neutrophils that mobilize. So very commonly, if you have a bacterial infection that's going on, those neutrophils will be up. Lymphocytes are classically associated with viral conditions. So if you have like an Epstein-Barr virus or a cytomegalovirus going on, then those lymphocytes are very often going to be elevated. This can be also elevated in other like more acute viral illnesses as well. Monocytes is one that we see elevated less commonly, but these are going to be the ones that are a little bit more elevated in chronic infections like tuberculosis. Apparently certain autoimmune diseases can also increase monocytes as well. Eosinophils, classically, what they're meant for is to fight parasites. So if your eosinophils are high, that could indicate that you have a parasitic infection. More oftenly these days, it indicates more that you have more of like an allergic activation in your immune system. And then you have basophils, which are kind of on their own. They're not really commonly elevated. If they're elevated, then there's something really weird going on. But as far as their role, they're also on that Th2 arm of your immune system. So they have more to do with like the parasitic allergic side of things. They're just less often elevated in that sense. Now, if you have bands or immature neutrophils, this means that your bone marrow is working really, really hard to push out those foot soldiers. It most often means that you have something that your body is really trying to fight. You shouldn't normally have bands or immature neutrophils if you don't have an infection or anything else going on. Now, there's a little bit more that you can read into the white blood cell count, especially since in research, there's a lot of looking at the ratios between the different white blood cells and taking a look at what that might mean. But I'll go into that in a different video here since that's a little bit more, it's more research oriented and it doesn't have as big of like clinical significance as just looking at the numbers of the different types of white blood cells do. So yeah, hopefully that helps. Let me know if you have any more questions.